Welcome back to the Catalyst Pharmacy Podcast. Today we had Benjamin Jolley with Jolley's Compounding Pharmacy on. Also, he's got a consulting arm of his business, works with Hinge Point as well on some patient messaging pieces. But he just wrapped up a project around pharmacy closures that he's going to talk through a little bit, talking about getting his opinions on just where we are in the state of the world with pharmacy reimbursement, what could happen towards the end of the year with legislation being passed, and we'll take you there now. So yeah, tell me a little bit about one, you do so much consulting for people, and yes. I'm gonna just commend you for how much you are available to help other pharmacies and pharmacists in the world. So and especially with Pioneer users, but also not even Pioneer users, you name it. You've had to basically charge for your time now because of how much you've had to figure out the balance of helping people with the balance of still running your business as well.
Right. Yeah. I mean, this all grew out of just helping people on Facebook of, hey, how do I do this thing? How do I do that thing? Well, here's how you do that thing. And then people started asking lots of questions. And then someone said, I want to pay you. And, 5 years down the line now, people have paid me lots of money to do lots of things for their pharmacies, and I've, it's been a great blessing to me, and I've been happy to help so many other people with DIR fees, with effective rates, with understanding how Medicare works, with understanding how to build care goals, which are a wonderful tool, but are frankly over-engineered. But they're a wonderful tool. I will repeat that over and over again. I don't know. It's been a really wonderful experience for me to be able to help other people. I don't know. So you want me to just tell you about all the crap I do with my life?
I do. I want to know about the stuff you're doing for the project. You just completed a really pretty daunting project that was a little crowdsourced, but a lot of elbow grease from you as well. And I think you highlighted someone to thank as well. I'll let you do that. And but also what you're doing with Hinge Point. I think everyone's aware you're consulting at this point. I think if you haven't listened to him in some way, it's where have you been? But let's get into that. Wherever you want to start from those pictures.
Sure. Okay, so AELP is the American Economic Liberties Project, a research and advocacy group in D.C. We do mostly stuff focused on research and advocacy work focused on breaking up the power of gigantic companies across the economy, because in pharmacy, we all think about PBMs, right?
Sure.
And they dominate all of our lives. But, you look across the rest of the economy and it's not just PBMs. Pharmacy is not a uniquely, horribly monopolized industry. It's just one of the farther along industries. I mean, you look across entertainment, live events, you think Ticketmaster, right?
Yeah, they just went through that. Yep.
You go think about cattle ranching and other, meat production, and the meat packers have enormous power, and they impose substantially lower prices on the ranchers than they themselves are able to earn from the open market for finished product beef, right?
Yep.
And so while beef and grocery prices have gone through the roof the last couple of years, ranchers have not seen dramatically humongous increases in their revenues, right? It's the same, this sort of reminds me of the play Oklahoma. The song, "The Farmer and the Cowman Should Be Friends."
Okay. Yeah.
Okay. So the farmer with a PH, the pharmacist, and the cowman, the rancher, should be friends because we all face the same problem, which is big middlemen that take all of the money out of our industries.
Sure.
Right?
Yep. Physicians too, I think, at this point.
Yeah, no,
as well.
I mean, yeah, absolutely. Like your physicians, I mean, just in the last 5 years, we've seen the number of physicians that are in independent practice as compared to employed by a health system or a clinic
Right.
or private equity has crossed the 50% threshold. So now more than half of physicians are not someone who works for themselves, but they work for some large entity.
Yeah. Insurers buying them up too, all of that too.
Right.
Well. Yeah.
I mean, United Health owns 10% of all the physician practices in the country by count of doctors. They either own or control by management agreements, 10%. Like that's a frighteningly large number. It's not
I didn't know that.
nearly as large as their power in the pharmacy market, but still, it's incredible, right? And so, anyway, AELP brought me on to provide subject matter expertise around PBMs and healthcare generally. So that's what I have thankfully been able to do, and it's been a really rewarding thing to be able to work with a very what's the word? A prestigious group that knows their stuff, knows their way around Capitol Hill, knows how to get in front of people that listen. One of the stranger things to me that I will keep saying whenever people ask me about this job is that you can just write memos about things and just send them to people, and sometimes they read them. Like, for example, every CEO's nightmare is they do something terrible, they get hacked, and then they have to go in front of Congress and get the Congress people to, basically tear them down.
Mm-hmm.
It turns out that when they announce those hearings, if you want to, you can just say, hey, people that are on this committee that's holding this hearing,
right,
here's some stuff that you might want to know. Here's some questions that you might want to ask these people that you're dragging in front of you. And so, like a couple of times now, I've written memos to the members of the House Oversight Committee or the Senate Finance Committee or the Help Committee or whoever, saying, hey, you're having this hearing today about PBMs, about Ozempic, about whatever it is.
Right.
And we just say, here's some stuff you might want to know. Like, here's who the CEO is. Here's how much money they made. Here's here's what their company does. Here's their different verticals. And here's some questions you might want to ask them. And a couple times now, some of the questions that we've suggested have actually been asked, which is really weird. But it's a thing. And so, go ahead.
I know. I was just going to say that's one, just such a practical take on you could just do this. Not many people think people. I tend to be in this category. Just think it's bigger than that. You know what I mean? Like it's more complex than that. Like it's more like whatever it is. Like there's an access that I don't have. So I just sending in, hey, a question set and some education on what's unique about happening in your pharmacy or the data and have about either the company you're talking about or whatever. I do think a lot of people in general, I am included, that it's it can't be that easy. It's not that simple, is it? And it sounds like for the most part, it can be.
I guess in part it's that this group has been around and has established AELP is a lot bigger than me.
Sure.
Right.
Yeah.
And it's established its reputation as a credible organization that provides good information. Right. So there is some degree of I've been injected into a group that,
Sure. Yeah. That helps. Yeah.
That has some clout. But, it is though an interesting thing to think about. When you consider that, senators, congressmen, there are only, 545 of them, right? 535 of them on the whole Hill.
I should know.
And
this.
like they have 535, 100 senators, 435 representatives.
I knew the senators one.
And they have, broad authority over writing legislation that can affect anything in the economy. And like, you can't expect one person to know everything about everything.
Every industry. Right.
Right.
Top to bottom from each vertical that they're in. Yeah. There's just no way. You just can't. Yeah.
And so it's a similar kind of, it's a similar kind of experience to, say, in the case of like a big lawsuit, you'll have various interested third parties that aren't party to the lawsuit send friend of the court briefs. Mm-hmm. This is a friend of the committee brief, right?
Right.
It's the same kind of concept, but I don't know, that just has surprised me that existed. Like, in retrospect, it's kind of obvious that, people who are interested in what a committee is doing would just say, hey, here's what we think about this hearing that you're holding. But like, before taking this job, I had no idea that was a thing.
Yeah.
And so anyway, it's gotten me very deeply aware of what happens in Washington, D.C., which is also overwhelming. There is a lot of things going on in that city. Mm-hmm. I don't live there, but yeah,
I feel like it's ran by 25-year-olds for the most part.
Yeah, it is.
Yeah.
No, it really is. Yeah. I mean, I have interacted with a lot of those 25-year-olds that are, Yale graduates, Harvard graduates, random other place graduates that have gone and taken jobs with a senator or a congressman, and they are informing a lot of the policy. Because again, one person, a given senator can't know everything, mm-hmm. and so they hire staff people, but mostly the staff people they hire are 25-year-olds. There are some that are older and really know their stuff, but like, mostly it's 25-year-olds. So I've interacted with a lot of them, and they're, on the most part, brilliant people. But again, like, you can't expect even the most brilliant 25-year-old that's assigned one industry to know everything.
Yeah.
Right?
Yeah. I'm still learning, and I've been around 20 years now. I'm still learning, so I can't. Yeah, you can't. So, okay.
But yeah, I mean, AELP has been a great job. It's a good opportunity to actually make a difference in policy and talk to people about the structure of the pharmacy market and how messed up it is, right? So like, I've been able to talk to people about TRICARE and how the Express Scripts contract that was offered to TRICARE is unjust and insane, mm-hmm. or that the contracts inside of Medicare are getting consistently worse and unacceptably low. And so we're able to, like, I'm able to make a difference at a different level by being a policy person rather than specifically a pharmacist working in a pharmacy. Because, like, I love my job working in the pharmacy. I do that one day a week. It's wonderful. I love taking care of people. But, like, there's a different scale of how much effect I can have in the world. At the pharmacy, I can have a very deep level of impact on a few people's lives, where in this other job, I can have a very broad impact on a lot of people's lives, right? And it's good, though. You also asked me about this Hinge Point thing.
Yeah.
So about a year ago, my good friend, Scott Robinson, mm-hmm. at Beaver Drug, another Pioneer user, yep. Has multiple stores throughout multiple states. He and some of his business partners approached me about this concept, and we've built a software to assist pharmacies in nurturing their patient relationships.
Okay.
So, like, you could theoretically do the same kind of thing that we were doing using the care goal text message stuff, but it would just take a lot of effort to build. Mm-hmm. What we've done, though, is we've built, like, a series of text message campaigns around just making sure that when someone thinks pharmacy, they think your pharmacy.
I got
right?
it. Okay.
Or when someone thinks, and around various services that pharmacies can offer. So, for example, a number of pharmacies have started to offer point of care testing.
Mm-hmm.
We try to make it so that people in the right age band are aware that you offer that service. And so when their kid gets strep throat, the first thought in their mind is, I'm going to go to Jolley's pharmacy to get my strep test.
Yeah.
Not, okay, I'm going to go to the doctor. It's going to be a pain. I'm going to pay a $97 copay.
Yeah, it's still $100 at the doctor, even with insurance. Let's be real.
Right.
Like,
yeah. I mean, I have used this service myself, not at, we don't actually currently offer this service at Jolley's, but I've used point of care testing for my kids whenever we've gotten strep, just down at the local grocery store that's, a couple blocks from my store.
Yeah.
And I charge $39 to do a strep test, and then prescribe antibiotics against it. And it's a phenomenal service, and it's it's much faster than waiting at the urgent care. Mm-hmm. It's way cheaper. $39 will beat the $97.51 that I pay with my insurance for an urgent care visit.
Yep.
We've had a few of those, as you can tell from me knowing the price to that point.
Yeah. No kidding. You sound like you have like real world experiences lately.
Yep.
Yeah.
It's way cheaper. It's a better experience, and then they're able to fulfill the prescription immediately. And so like pharmacies should be able to do this across the board. And it's a good margin service for the pharmacy as well, because doing a strep test does not take that much effort.
Right.
It's something that you have to have the infrastructure in place for, but after that, it's mostly you need to make people aware of it, and then the pharmacy earns margin towards the bottom line every time, because it's a cash paid service, right? And there's no PBM telling you what the price is. So anyway, and then additionally, we offer some services around helping folks set up an insurance agency.
Yeah. Okay. All right.
So I passed my insurance agent exam a month and a half ago.
Okay.
Because you know what? I realized that every Medicare open enrollment, I am helping people choose their plans. And during ACA enrollment, I've been helping people choose their plans. And you know what? I should be compensated for doing that.
Mm-hmm.
So,
absolutely.
And so I got my insurance agent license a month and a half ago. I secured my errors and omissions insurance policy against my making mistakes in that yesterday.
Sure. Okay.
And I've applied to be contracted with all the different insurance carriers so that they can pay me when I help someone enroll in their plans.
Okay.
Like I've done this personally, and then Hinge Point helps pharmacies do this at scale. Again, using our technology platform to assist people in marketing that service, but also setting it up. So we can help people get through the licensing process, get through the training that they need. But any pharmacy that helps people to choose their Medicare plans, that's a real service that people are paid substantial amounts of money to do if they are licensed as an agent and they are contracted with the plan. To put some numbers on it, every time a person signs up for a compensated Part D plan for the first year, the agent gets $100 per person.
Oh.
Every time someone signs up for a Medicare Advantage plan, the person, the agent will get $642. I mean, that is
what?
That is a lot of money, right? And so if a pharmacist is out there like, I'm going to go help my people choose plans because it'll earn me money in the form of they won't go on the plans that are bad for them and are bad for me, right? That works. I mean, you can do that. That's how I've done things for the last several years. But, you put a number on, okay, if you help 100 people choose Medicare plans, that's $60,000 if they choose Medicare Advantage plans, or it's a little less than that if you're mostly picking Part D plans. But like, still, that's 5 figures of revenue that you could have earned.
Right.
And so again, we have campaigns to say, hey, did you know that Jolley's Pharmacy offers insurance agency? We can be your agent. We can help you pick plans. You can sit down with our pharmacist agent who knows drugs and knows insurance and can help you actually pick a plan that makes sense for you. And anyway, and also to do this at a larger scale, we have a call center to be able to take calls. We make sure people know that the pharmacy has an agency that we can offer these services. And anyway, so we're helping a good number of pharmacies to operationalize an agency and earn some revenue from helping their patients to choose Medicare plans, because it's a incredibly momentous decision from the perspective of a patient, right?
Yeah. No, like I haven't gone through it yet with my parents, but I'm about to. Like I'm 2 years, year and a half away of like the very first Medicare plan that my dad's going to pick. He doesn't know where to start with that at all.
Right.
Like he's like, he's 60, he'll be 64 in October.
Okay.
Which 65, we all know.
Yeah.
And so it's like, and honestly, he's asking me, and I'm like, I need to go get educated on that. I was like, I don't know, man. And he usually like, not that I'm even remotely close to any type of like clinician on the world, but they're like, you're in pharmacy. I'm like, okay.
Yeah, you know what's up, right?
Like, don't show me rashes and I'm okay. But yeah, I'll be really fair. Like there's not like, to me, I don't, other than the AARP, I don't know the other resources are really even available to people that are top of mind, like you said. But the pharmacy is by far like he knows this pharmacy. They don't do this for their patients. I think the word is yet for that, but he would totally trust that the group of people he sees every month, he's got access to them. They already know his healthcare really well. They understand what prescriptions he's on already. So it is such an easy, like, to me, like transition or reach or whatever you want to say to go, okay, yeah, like your entire patient base that you already have would trust you to help them with this. Pick a win-win.
Yeah. I mean, there's additionally, like beyond that, I mean, your dad would be like the exact kind of person that we would start a very slow text message campaign to. When they're 63, turning 64, turning 65,
yep.
we start a campaign of just, hey, this is so-and-so pharmacy. We have an agency. We want you to be aware of what Medicare is, what the parts of it are, what all these different terms mean, so that when you get to the point where you're actually signing up, you know what's up.
Mm-hmm.
Right?
Yeah.
And so we start with a campaign. Okay, here's what Medicare Part A is. It's hospital coverage. Here's what Medicare Part B is. It's doctor coverage. Here's what Medicare Part D is. It's drug coverage. But like this is dripped out over the course of months and months and years, so that it's not an overwhelming, okay, I have to learn all of this right now.
Right. Yeah.
While I'm signing up for a plan. And I mean, the scale of the choice of choosing different insurance plans, like in the Medicare space, here in Salt Lake County, there are 21 different Part D standalone plans and 37 different Medicare Advantage plans for a senior to choose from.
Holy smokes. Yeah.
Right. That's a lot of like, and like making the wrong choice means that, okay, your drugs cost more. Maybe they're not covered. It means your doctor may or may not be in network. It means your hospital may or may not be in network. There's a lot of responsibility in that decision. And, one of the things that constantly surprises me is how little people understand of relatively basic insurance terminology that pharmacists deal with every day.
Yeah.
Right. And I'll give you a little pitch for using Pioneer creatively.
Okay.
So I wrote on my blog a year and a half ago, something like that, a response to an article written by a gentleman whose name escapes me. Yeah, can't remember it. Who used to be a Cigna executive. He worked at Cigna. He was in their political affairs. Okay. He wrote an article describing his experience getting his inhalers through his Medicare plan. Specifically, he was originally prescribed Symbicort. He went to CVS. He picked up his Symbicort. It was $606 for a 3-month supply. And he just is like, holy crap, that's a lot of money. Can I do any better? So he goes to his doc, back to his pulmonologist. So specialist visit.
Sure.
Goes back to his pulmonologist, says, hey, is there anything else we can do? Which, that's probably a good choice, talking to your physician. And his physician's like, well, yeah, there's generic ones. We could do Wixela, generic Advair. And so he says, okay, great. And he takes his prescription to a Rite Aid. So starts at a CVS, goes to a Rite Aid. To me, pharmacist, that's red flag number one. Use one pharmacy. Yeah. Right. Even if it's a CVS, use the same one so that the same person
go back to the go back
knows your history. And can help you with it. But whatever. And he goes to this Rite Aid, and he picks up his medicine, and it's what's 47 times 3? It's $141 for a 3-month supply. And he's like, fantastic. I'm doing great. I saved myself a bunch of money by talking to my physician. Here's the part he doesn't realize. The $606 was because he had a deductible of, this was a couple of years ago, so it was, I think, $495 was his deductible that year. And then his copay was actually $126 after he met his deductible. Okay. So it was the deductible plus $126 was his $606 copay.
Yep.
Right. And so he's sitting there thinking that he's saved himself all this money by going to his pulmonologist, getting a different drug prescribed, and then going to Rite Aid. But the Symbicort would have been cheaper at the CVS had he just stayed on it for the next 3 months, because he didn't know about the deductible. But here's where Pioneer comes in. Around that same time, Pioneer had programmed or had bound a couple of fields onto the label design for the deductible fields. Mm-hmm. So accumulated deductible
Someone
amount.
Gave us that great idea.
Applied to deductible. Oh, I don't know who gave you that idea. It might have been some dude in Salt Lake. It may have been someone else. I don't even remember.
Yeah.
Anyway, it has the deductible fields on it. And so I put those on my label right by the price, so that when my staff is ringing someone out and they say, oh my gosh, $606, what the heck is that about? My staff can just say, oh, well, that's because you have a deductible that you met. It's this year $545, next year $590. But if, next month your copay will be substantially lower because you met your deductible. And so that allows my staff, even my clerk who is afraid of computers.
Yeah, everyone to be educated, right?
She can have this conversation with the customer. It doesn't have to be me. It doesn't have to be the other pharmacist. It can be my lowest level clerk who is afraid of computers and does not want to deal with the computers. She does a wonderful job talking with customers. She does a wonderful job helping folks. But she doesn't want to learn how to go into the computer and find the EDI received,
right?
deductible amount remaining. But because Pioneer has written that into the code and I took the time to put it on my label, now she can interpret that information and explain to our customers why it is that they have such a high copay. And that it's not a forever thing, and they should not go back to their pulmonologist and pay them whatever copay they pay for a pulmonologist visit.
Right. Another $200
out
of
was
pocket.
Not a costless visit.
Right. That wasn't a $0 visit by any means.
No,
probably.
It was not.
Yeah.
And so, anyway, the point is though that like pharmacists understand the nature of these, arcane insurance terms like deductible, co-insurance, copay, intrinsically because it's what we do every single day.
Yeah, all day.
We deal with processing people's insurance claims. So like, I've described that a pharmacist as a job in the past. I've described this as somewhere between a physician, a grocer, and an insurance adjuster.
That's a great way to put it. That's such a good way to put it. It really is.
I like some of those jobs more than others, let's just say. But like, as a clinician, I talk to people. I help them understand their medicines. I have to know all of these concepts about medicine, what side effects they'll have, how they work, all of this, how the disease state that they have works. So I have to have that in my head. But then I also have to be a grocer because I have to maintain inventory. I can know everything there is to know about drugs, but it helps no one if they can't actually get those drugs in their hands.
Can I say also one thing to add to that?
Sure.
Is based off what you just said earlier, I don't know of a world, this is more about the insurance piece that you talked about. I don't know of a world where there's 37 choices for anything, even inside a grocery store. Like navigating that in general by yourself with no prior knowledge of being a clinician at all, which is where my parents are.
Right.
Yeah, it's a shot in the dark.
I mean, people need help.
Mm-hmm.
And some insurance agents that are not in the pharmacy world are great people. They know their stuff. They know what's up. Some of them are not. I have met people that are brokers that are incredible people, mission-driven, want to help people understand their healthcare. Some of them want to earn commissions, and that's it.
Yeah.
And there's a difference in experience there. But I think that anyone who is taking the time to help people pick these plans should be paid for it. And so that's a big part of why Hinge Point exists, why I joined the company, is because of that, but also because there's a lot more that we can do with because frankly, even the most basic thing we do of just brand awareness, of making sure that if someone has been in your pharmacy, the next time they need a pharmacy, they think of your pharmacy. Mm-hmm. Instead of thinking of Walgreens or CVS or Rite Aid or Walmart. Like, that's an enormous thing from the perspective of a pharmacy owner-operator. Having people know that Jolley's Pharmacy is pharmacy. To me, when I think pharmacy, I think of my own pharmacy first. I don't think of Rite Aid, CVS, etc. But to the average consumer out there...
Sure.
These companies have very large ad budgets. I see CVS. I see CVS ads in my social media feed all the time. And so, cutting through that noise to be able to say, you know what, Boscobel Pharmacy exists, or Nambi Drugs exists, or Beaver Drug exists. And that is the pharmacy, is a very useful thing. And so anyway, that's what we do at Hinge Point. Is that a good enough long sales pitch for you?
That's good. Like, I don't know. I like the comprehensive walkthrough. That's who I am in general. So that's what we're here for anyway.